Okay, we are live on the stream. Now I have to hit
Oh.
record. Okay, now we are recording. So
All right.
Julia, take it. I'm gonna actually try to find the agenda too. But yes,
Yeah.
go ahead. We could start with introductions.
So I guess we'll call to order the meeting. First, we want to do roll call. Do you want everyone to just kind of introduce themselves for our new student members, and maybe student members, we can have you introduce yourselves at the end so you're not put on the spot right at the beginning.
I think that's a good idea.
Okay. So name, how long we've been on the commission, maybe?
That's probably enough.
And all right, great. So my name's Julia Selles. I've been on the commission for about 2 years. Should I just go down the list?
Yeah, you might have to direct people.
All right, I'll do that. Michael.
Hey, everybody. My name is Mike Wood, and I have been on the commission for, we had one meeting and then COVID hit. So we had one, I think, in-person meeting, and all the rest have been Zoom. So
Okay. Amanda Herr.
Hi, I'm Amanda Herr. I've been on the commission for 3, 4 years. I'm not quite sure. More than 2.
All right. Greg Wright.
Hi, Greg Wright. This is my 4th year on the commission.
All right. Philip.
My name is Philip, and I have been on the commission since March.
Rob. Rob, I don't know. Can you hear me? All right, we'll go to Tracy then.
Hi, I'm Tracy Nelson, and I too have been on the commission just since March.
Maybe back to Rob.
This is Rob Lesh. I've been on the commission, well, going on my 2nd year.
All right. And then we'll go through our 3 new students that have joined us. Sorry, I'm scrolling back and forth. Ellie?
Hi, I'm Ellie. I am a sophomore at Edina High School, and this is my first year on the commission.
All right. Eva?
Hi, I'm Ava. I'm a senior.
Oh, Ava, sorry.
Oh,
I
it's
apologize.
okay. I'm a senior at Academy for Angels, and this is my first year.
All right. Isadora? Did I pronounce that correctly?
Yeah, so my name's Isadora, but I actually go by Issa.
Okay.
And I'll be a junior at Edina this year. And this is my
Nice.
first time on the Community Health Commission, so.
All right, great. So the first thing we're going to do, thank you for introductions, everybody. We'll look at the approval for the meeting's agenda.
Hi, this is Tracy. I move that we approve it.
All right.
Greg, I'll second it. It's kind of sparse.
Yeah. And then do we have anybody opposed? All right. Approved. And then we'll review the meeting notes from August 10th, our last meeting. And Jeff is scrolling down so we could see those notes.
Oops.
You can still see the minutes, right?
No, we see gray now. Sorry. We saw it at the beginning, but now we can see them again.
Oh.
Do we have a motion?
Motion to approve the minutes. Thank you.
I second it.
All right, Tracy seconds. Anybody opposed? Nope. All right. Minutes have been approved. All right. Do we have any community comment? Jeff, I don't know if you had anything before.
Nope, nothing.
Anybody? Okay. Then are we good to move into reports and recommendations for the 2021 work plan? Or is there something else I missed?
Nope, that's it.
All right. As I said, it's been a Monday, so, correct me if I'm doing something wrong tonight. Okay, so we'll jump into the approval for the 2021 work plan. Jeff, I don't know if you want to scroll down to the work plan.
I just tried to change something so Andrew could get on here. Andrew, did that work?
Oh.
Are you here?
Yeah, I was wondering why. I see Michael.
I can see
Greg.
him. Oh yeah, there he is. Good, cool.
Oh,
All right.
Hi, Andrew.
Hello.
Just perfect timing. So we were just about to go over the 2021 work plan proposal.
Okay, can you see it now?
Yes.
Okay, good.
So we have, I think, 3 initiatives that we have this year, and a lot of stuff was continuing from last year. A lot of stuff didn't really get a ton of legs because of COVID and just life kind of stopping for a little while. So the first item is a project. It's a study and reports benefits of social connectedness, including examples of locally focused initiatives from around the state/county to reduce social isolation. So the deliverable will be to report to council. We don't have any leads designated yet, and the target completion would be a year from now, so third quarter of 2021.
And the Vitals app matter will be added to that initiative, correct? So that's what we talked about last time.
Yeah,
I
that could
think we
definitely be
talked
part of
about,
the report.
yeah, kind of as an example.
Okay. Even though I'm not reading it, it is there.
So it would be part of the report to council. That
Okay.
could be included in that because it says including quote technology and health from 2021 parking lot in this item. So that would be included in that.
Perfect. Thank you.
Okay. Yep. Any questions, comments, concerns? On that initiative? That is not me. I have new noise canceling headphones, so it is not me. It's usually my kids in the background, but this time it's not. Okay, we're good. I'll move on to the second item. So the second item is also another project, the study and report possible city actions, policies, or code changes regarding smoking activity in multi-unit properties, include local and national examples. This is also a report to council. This is also similar to the last one, a continuation from 2020. Questions, comments?
We have that report, which I don't know. I suppose everybody probably hasn't seen that because we have a kind of a switchover of some members. Bloomington Public Health did a kind of a survey of multi-unit properties in town and produced a report about preferences from people living in multi-unit properties about smoking. And with that, plus some recommendations or some, I guess, options that they provided that could be done. or they have, it's kind of a head start probably on this item because it lists out some, guess tobacco prevention activity that could happen. And it's not in there. In that document, it talks about lots of different things, not just in multi-unit housing. Like one of them was a flavor ban and stuff, which we already have done. But I should resend that out, and I'll do that so that people can have that document.
Great, thanks.
Did they, Jeff, I got a question. Did they give examples of existing facilities and, you know, maybe proposals for new facilities?
I don't know that for sure. You mean like kind of allowing existing facilities to operate how they are, and then like having some kind of requirements on newly built?
Yeah, did they do that comparison? Because I think going forward, we could make suggestions for code on new buildings. I think it's, you know, existing would seem it's a little more difficult, I think.
Yeah, that is it's one of the things that always comes up is how do you change, you know, an existing situation. But the data that they gathered, they did a survey of 6 properties in Edina, 3, if I remember right, 3 that currently have allow smoking, and then 3 that are non-smoking. And then they ask similar questions about like how is it like enforcement and how often do you smell smoke and stuff. So I'll send that out. It'll give whoever that is on that group, it'll give you a head start to kind of things to think about.
I think, Andrew, you and I are still on it.
That's what I remember.
Yeah, I am too.
Yep.
Okay.
And I think I was as well, Ms. Tracy.
Yeah, yep. Okay. Anything else on initiative 2? Okay. So the third initiative, so this is another project. It would be a report to council. So it's a study and report on existing programs in Edina and Hennepin County regarding opioid use. Provide examples of efforts to increase public awareness of existing programs. And this item was moved from the 2020 parking lot to a 2021 initiative. Any questions, comments, concerns on that?
My only question is, all 3 of them have the same target completion date. Is that realistic?
Excellent question.
The reason I put Q3 is because it was a full year from now. And then instead of Q2 or Q1, which if we get a start on one, you know, that by the end of this year, it could be that they're done in the first quarter or second quarter of next year. It's kind of a Q3 is kind of a, I mean, it's right now, and we'll be working on the next year's work plan. So it's kind of like the work plan calendar year, I guess, if you could say it that way. So
more of a completion within the next year. It's not a hard, like if we got it done early, great.
yeah, exactly.
Okay. All right. Is there any other comments on the work plan? Any of the initiatives?
Awesome.
All right. Well, do we need to approve the work plan then?
Yes.
Okay. So do I have a motion to approve the work plan?
Motion to approve, Andrew.
All right. Do we have a second?
Second.
That was Philip. Does anybody disagree? Any nays? Nope. Okay. 2021 work plan has been approved.
Good deal.
This meeting is all right. Does anybody have any comments? Member comment time?
Whoops.
I have something I would kind of like to share with the commission. Right?
Okay.
At the encouragement of several people who are closest to me, I am in the process of working on a potential podcast for the autistic adult community. I have a title selected. I have some incredible backing to begin this particular project. It is a big undertaking on my part, and it is still in the early stages of construction. But with any luck, as soon as all the legal pieces and puzzles get put together, it may be available as early as mid-October. So I just wanted to share with everybody, and I know there are community members who may hear this, but the adult autistic community is still one of those things that is often very much unrepresented. And so, like I said, at the encouragement of several people who have encouraged me, I am beginning this project, and I would hope that my members of as soon as I know more, I will alert Jeff and others about when this begins, and I do hope that you will tune in. So that's one announcement I make, and I appreciate anyone supporting me on this issue, this opportunity. So I'm just sharing that, and thank you for the opportunity.
Philip, best wishes on that. I thought of you and the app with the terrible news from last week of the autistic young man in Salt Lake City who thankfully is going to survive really a completely unreasonable attack upon his body.
Yes, and yeah, things like that are exactly one of the reasons we want to get the app on board. Which leads me to a question. We spoke about maybe talking to other cities regarding the app, and I'd like to know how those tasks are going to be. Who's going to do those tasks, and how are we going to decide who does those tasks? As long as we're talking about that, thank you for bringing that up, and I appreciate that. But my question is, how are we gonna plan who does what on that?
So in the past, or kind of what most commissions are being kind of directed to is assign commission members to the work plan initiatives. So, like we have 3 initiatives, so it might be somewhat, we don't have like 15, like some of the commissions have a lot of initiatives, but we can break down the initiatives into, people who are assigned to those, and then people who are assigned to that initiative can do outreach to those communities. There's bound to be, and I can help with that too, if that makes it better. But we can make contact with cities that are using the app, or if they have a smoking policy that we want to know more about. We can make contact and then try to get information from them. So I would say once the kind of working groups are set up for each initiative, then it can be kind of figured out between that group who's going to make contact with other cities or other organizations.
Thanks for letting us know that, Philip. That sounds great. Good luck.
Thank you for that. I
Yeah.
must say, the encouragement to do it is a complete surprise to me. I never thought of doing any such thing. So this is one of those things that just kind of come out. We think you should do it, and so I'm gonna go for it and see if I can make it
Yeah.
happen. So,
Why not?
Sure.
Awesome.
Yeah, that's great. Yeah, please let us know. Are there any other comments from people? Anything else going on?
Julia, at some point, would we plan to assign various people to each of the three work plan items?
Yeah, I think that'd probably be a good idea. Maybe first we could talk to people who are initially on from last year's initiative 1 and 2 and see if people still wanna stay on that, or if they have interest in moving off or moving to initiative 3. Jeff, does this have to be approved first before it's official from council?
Yeah, I think at the October meeting would be a good meeting to do that, to kind of divvy up who goes where. Because I have to submit the work plan for council or for city manager review, and then council review is like later. So it is a couple step process, but I'm assuming that it'll be pretty much what it is now. And if we take the October meeting everyone can think about it from now until then. And then at the October meeting, we can maybe, decide who's gonna work on which item.
Sounds good.
Does that sound good to other people too? Or if you're not comfortable saying it in a group, maybe just send Jeff a message, which one you'd like to work on.
And students, you don't get off the hook. You get to be part of a group too. So there's 3 of you and 3 initiatives. So you're probably gonna get one foot on each one. So
Yeah. So think about which ones you want. If you have questions, let us know. Any other comments, questions from anybody? Was it
Karen,
first day of school for everybody, so we're a little bit brain dead today? That's how I feel. Yeah.
my turn.
Yeah, please.
Okay. So I guess a couple things going on. Dina has stepped away from the commission. She said she can't fulfill the commitment any longer. So we're down to 8 people. So that's what we'll have for the rest of this until we get. I guess the big thing going on right now for us in my division is we're trying to set up a community testing event with the CARES funding that the city received, or some of the CARES funding. So the city was approached, and I can't remember how much of this I've shared with you all already, but the M Health Fairview approached the city about CARES funding. And then part of that like discussion about the funding going that direction was we can do that through a community testing event, or we'll work out some arrangement and do a community testing event. So that had kind of sat for a while, and then it really kicked into high gear here a couple weeks ago because the money needs to be spent by November 15th. So we've had a couple meetings about doing an event. M Health Fairview's done a lot of events with Ramsey County as the government partner. And so they've got the kind of the medical part of it figured out, like drive-through event, swabbing people while they're in the car, that kind of thing. It's all outside. We just have to figure out our part of it, which is mostly logistics, getting a site set up, or a site selected, finding staff and volunteers to work the event. You need about 60 people to work the event. That's including the swabbers and stuff that M Health would provide. But you need people like registration, traffic direction, you know, supply runners, stuff like that. And then we need to find, I guess the other events are successful when they have a good community partner involved, which with a recent event in Bloomington that was put on at Kennedy High School, Head Start, Parents and Community Action Head Start was the partner, community partner. So basically what happens is there's like time slots given, you register for a time slot if you want to be tested. And Parents and Community Action Head Start got like a certain allotment of like 60% of the slots, and then the remaining 40% were like general public. So, and it's like a registration link, almost like a WebEx link or something, and you sign up for a time. And so you can target with the registration link certain communities or demographics. And the Bloomington event, which we're going to mimic basically, was to target communities of color and try to get people to the event that may have some kind of barrier to testing, whether it's transportation or time of day or cost or anything like that. So that was the initiative, that was the effort there. And the community partner helped a lot with finding those folks. So we're trying to find a good community partner here that can help with that in Edina. The Bloomington event tested almost 1,200 people in one day, and they had a wait list of almost that many too. So there's a lot of people looking to get checked. So we think we can probably do about that many, but we're thinking about breaking it up into 2 days. Like we're talking about a couple different places, but you know, there's only a certain amount of parking lots in Edina that can handle 4 lanes of drive-through testing, so it needs quite a bit of space.
So Jeff, I have some questions.
Trying to have it happen in the end of October, so pretty fast. Julia, you're gonna say something.
Yeah, I have a question. Is it limited to Edina residents, or would it be open to anybody?
I think our marketing, we're gonna target Edina residents, but if people show up from Richfield or Bloomington or somewhere, we're not gonna say no. Basically, the guidance I got was if you plan for, you know, 600 tests, you order 1/3 more because people are just gonna show up. Like you gotta have an extra 30%, you know, in reserve because there's just gonna be overflow. So we're not gonna market it outside the city. We're gonna really focus on Edina residents. But because of our relationship with Bloomington and Richfield, there's likely gonna be some spillover and stuff. So
Mm-hmm. And since Bloomington's already done this, I'm guessing that Bloomington Epi is already working with MDH about the influx of contact tracing once the event occurs.
I'm not sure yet. They have a meeting tomorrow with the
just
FEOC,
put that out there.
the Emergency Operations Center folks that help get the tests, and there's a software system that helps with registration and the scheduling and the tracking, and that's you kind of get that through the state as well. So there's a lot of parts to it, and every time you think you have kind of a handle on it, there's more parts, and there's just a lot of pieces to put it together. So plus the time is short, so it's real exciting.
Yeah.
I'm trying to think if I have any other updates other than that. The tobacco lawsuit thing, I think, did we talk about this last time? The judge basically said the ordinance can go into effect. So the lawsuit has kind of been decided. So that went into effect September 1st, the flavor ban. So I've had a couple calls about, oh my gosh, we have all this stuff. Do we have to get rid of it? you know, all that. And I kind of said, you know, we're not doing compliance checks immediately. Don't order anymore, you know. So, so we'll see, you know, in 6 months, probably in a couple months, we'll do compliance checks and start checking on folks. I didn't want to do too much, too many like announcements or activity in the community, because if the lawsuit went a different way, that wouldn't have been, I guess we would have a lot of misinformation out there. So probably more to come on that, but that's that. Otherwise, we're getting back to doing inspections. Rental inspections are starting. We're starting to, or are continuing. We're starting to go into apartments now, as kind of they feel comfortable with it. So it's kind of, we've just started making those phone calls. So it'll be interesting to see how apartment complexes feel about inspections, and tenants, how they, you know, how they feel about inspections. So we'll see where that goes. I think that's it for me. Anybody have any questions about any of that?
So in other words, the lawsuit piece is done, or it's done, mute, decided, done.
Yeah, it's done unless there's an appeal. So I don't know if that's going to happen. I haven't really been involved in it at all. The city manager and city attorney, I think, just handled it. So, but I guess I would get, well, I guess I don't know. I'm not sure. It's possible, but as of now, it's in effect until we hear different.
That's good news.
I have another question. So I realized I'd asked a contact tracing question. Do you know whether Bloomington EPI is going to join the regional model, or are they going to stay doing contact tracing the way they're currently doing it? Do you know?
No, it's going to be the regional thing. I don't
Okay.
know if is that even an option really?
To keep doing it the way you're doing?
Yeah.
Yeah, there were 3 options apparently.
Okay, because right now Bloomington is taking some of the 3 cities cases, but not all.
Yep. Yeah, same for Hennepin. I don't
Yeah,
quite
so
understand it all, but
so I imagine that
okay.
we will be participating in the regional contact tracing
Okay.
model.
That just might have impacted when I asked the question, I was realizing that depending on when and if going to the regional model might impact the question I previously asked. So anything else, Jeff? Have people settled with organics, or is it have we gotten over the hump?
It's okay. The calls are kind of shifting a little bit. People were still, up until a month or 2 ago, I think people were still noticing it on their utility bill for the first time. And so there still have been some calls. I've actually gotten more comments about the tobacco thing recently. Mostly about, this is America, this is my choice, kind of comments. But I think the organics thing is going well. Of course, you know, Twyla's our organics coordinator, and I think she heads off most of the stuff and answers questions before it gets to me. So I guess I don't know for sure, you know, if she's getting hundreds of calls a day or if it's dozens. I think it's more like dozens. I hope it's that and not, you know, not just overwhelming. I think it's getting more manageable. So
I'm just going to share this just because it happened during the month of August. I had an interim caddy case manager who lives in Edina. And when I mentioned about the organics recycling, she said she did not know that Edina started that program. She did not know anything about it. So I don't know how she didn't know anything about it, but she said she did not know. So it's kind of interesting, but I'm just saying. So there.
Huh.
I feel like this person must never be on Nextdoor or read like anything from the city of Edina, because I feel like it's been plastered all over like any city information. Not a complaint, but it's just been on it, and we all know it's been on Nextdoor. I don't think it matters where in Edina you live.
I don't know.
You're getting it on Nextdoor.
All I remember is when I mentioned it, she's like, gee, I didn't know that. I just thought odd, but oh well.
Yeah.
Maybe there are those who don't pay attention to city news, I guess. I don't know.
I don't know. Well, Jeff, I was going to say, if people are looking at their utility bills, I feel like mine just came in the mail today. So prepare for another round of calls.
Oh, I think that's all I got.
Okay. Well, let me scroll back to the agenda. Is anything else before we move to adjourn?
Jeff, are you looking for volunteers for that COVID testing?
We will be. We have a system in the city where you like register to be a volunteer. There's a little bit of a process, I guess, but there's kind of a volunteer roster. But yeah, if you're interested and want to sign up to do it, I can, just keep that in mind. And once we get to that point of, needing people to be there, I can let you know how that's going to work.
Well, even have we built the framework for the location and the traffic and all that yet?
We have some examples from the other sites. We just need to find a space that can accommodate it. We have a few ideas about that. Like Southdale Mall obviously has a huge parking lot. Braemar Arena has a big parking lot, but you also need power. So if you're going to do that, you need generators. We need indoor space for people if it's cold, heated space, because if it's the end of October, it might be cold. So you need some, restroom facilities, things like that. So depending on what site we utilize, we might need, the infrastructure is going to be different, but we have a general idea of we're going to do 4 lanes of drive through. That's generally what is done to have the capacity to get through the numbers that we want to do. Probably like 2:30 to 6:30 p.m. because then it'll cross over like when people are done with work. So if they work first shift, second shift kind of stuff, we might get more people. It's a more flexible time. So a lot of stuff to be sorted out yet.
Okay, do you need any help with that end of it? Or are you handling all that internally?
The planning stuff?
Yeah.
Yeah, we're pretty much handling that. It's, we have, like I said, we have examples from other agencies that have already done it. And then through our contract with Bloomington for public health emergency preparedness, we have a couple planners this is like their thing. They just love the incident command structure and setting up, like you've heard me talk in the past, some of you at least, about dispensing Skittles or M&Ms, medication drills. This is kind of right up their right in their lane. So it's the same kind of thing, but it's real life. So like the drills and stuff, we aren't even doing this year because we're all experiencing this real life, effort. So, but that part we've pretty much we've got a lot of cooks in the kitchen on that one. So I think
Okay.
we're right there.
Is there a prerequisite, like you have to have symptoms, or did they just open this up to whoever wants to get tested?
There's no prerequisite for symptoms. The idea is if somebody felt like they were exposed or was symptomatic and they felt like they should be tested, but there was some kind of barrier to it, that they could come and get tested. There's no cost. It's just you come in, you get tested, you leave. That's it.
Okay.
They're not billing your insurance or anything like that. It's just in and out. I guess what I was told is the thing that takes the longest is signing up if you didn't pre-register online. You basically pull in, they do the swab, and then if there's 4 people in your car, they'll swab every person. They put the sample in a pre-labeled or in a labeled bottle, and you're out of there. It's like a 3-minute stop, basically. So, but as far as I thought you were going to ask about prerequisites for volunteering. There is for if people are going to be involved in handling the samples or the swabbing or anything, which we're not going to have volunteers do that. But M Health Fairview has people that do that. So they have a threshold of, what people need to be, if it's a nurse or somebody that has experience and can take the just-in-time training and do the swabbing. The volunteers from the city are going to be doing registration, traffic control, logistics, supply running, that kind of stuff. I might be going to get box lunches, whatever. So that's the stuff that our volunteers are going to be doing, is trying to keep it running smoothly and give support. So
Okay.
one of my staff, one of my rental inspectors participated at the event in Bloomington, and he did registration. So he was basically down there helping people get registered, and then he speaks Somali, so he was willing to be interpreter too. So he was kind of filling 2 roles there.
From my experience, I would guess that you probably need some interpreters for the testing event. So if you're looking at volunteers, you might want to be looking at that skill also.
Yep. That's part of the plan, is we got to make sure we got lots of language speakers.
Was there I know this comes in, but maybe phase 2, has there been any talk about the antibody test? Which a lot of people want to know also.
Yeah, not in this way. It has not been.
And I don't know how much we want to really get into, but the latest data says that your antibodies are only good for 3 months. So if you take an antibody test, I don't want people to get this false, I don't know. They don't want people to think that you're immune forever, this false security, because you don't know what in the last 3 months, for example, you got those antibodies.
Well, it's also because the virus is mutating too. So the antibodies are going to look different.
A couple of things. That recent studies on the mutation show that the rate of mutation is extremely slow compared to other viruses. And at least for now, the antigenicity is about the same. But the problem is that the antibody tests themselves are not particularly reliable. And so CDC and others have discouraged placing heavy reliance on antibody testing in general, A, because we don't know what it means, and B, because we don't really have a lot of confidence in the testing itself.
Mm-hmm. I've heard the same things. Any other fun COVID talk? Okay. Well, if there anything else, I don't want to cut people off if we have more questions or more things we want to talk about.
Want to embarrass the students at all?
Ooh, only if you really want to. I made them introduce themselves, but I feel like I'm already that parent that embarrasses their kids, so I don't want to take it out on other people that I'm not related to. So,
all right, maybe next meeting.
Okay.
I don't know. I feel like I'm pretty immune to embarrassment at this point, so I'm going to bring it.
So you survived your first couple of days of, and you had last week, you had to show up for orientation, right? And then depending on what you picked, EVA or hybrid, you may or may not will L. So you start Thursday. Is KL?
Yeah, so
separation, I
L
think.
through Z, I'm in school Thursdays and Fridays. So
Mm-hmm. Yep. Ava, Ellie, anything we can? Nope. Ellie, are you doing EVA or are you doing hybrid?
I'm doing hybrid, so I'll be
Hybrid.
going on Thursday and Friday.
And now, Ava, you're at, you just said it like an hour ago and I already blanked.
Holy Angels in Richfield.
Got it. Holy Angels. Okay. And so are you all in person then? Or are you, what is your school situation?
It's hybrid. You can technically opt in to fully online, but I think there's only about 10 kids in my school doing that. And so ours is split up A through L and then M through Z. So for me, I'm the first half of the alphabet, so I go Mondays and Thursdays.
All right. So you were at school today then?
I was, yeah.
Okay. Was this your second week or your first week?
It was my third.
Your third week. See,
Yeah.
Edina, it was like our first full week. So we're still in this back to school mode.
Yep.
All right. Well, I hope it's going well for all of you, and it's quite an experience. I'll say that. Is that good enough, Jeff? Did I do
That's
it?
good. I think we can wrap it up if you want.
All right. Do we have a motion to adjourn the meeting?
Motion to adjourn.
All right, that was quick. Anybody opposed? Nope. All right.
Okay.
So adjourned.
See you next month.
All right. Thanks. We'll see
everybody.
you all. What
Well-
is the date? October 5th, 12th?
12th.
October 12th. All right.
Right.
Sounds great.
Oh, okay,
All right.
everybody.
Bye.
Say bye-bye.
Bye-bye.
There you go.
Bye-bye.
Say bye-bye. Bye-bye. Okay.